Lanka Hospitals lays claim to yet another first in the country's healthcare industry with a standalone Gastroenterology Centre specializing in the diagnosis and treatment of gastrointestinal, hepatological and respiratory disorders. The self-contained GE Centre is equipped with the state-of-the-art technology from the world of medicine that the private healthcare industry in the country has ever seen. The latest high-definition narrow-band imaging scopes provide patients the confidence that their diagnosis will be done with utmost precision. Patients can also witness the medical care of highly experienced, qualified and acclaimed consultant gastroenterologists and gastrointestinal surgeons at Lanka Hospitals GE Centre.
Combined diagnostic and treatment unit in gastrointestinal disorders has been a much needed facility for the private sector in Sri Lanka, and I am pleased to be associated with the Lanka Hospitals GI endoscopy and investigation unit that has brought about this new development in a one-stop shop of investigative disorders of the gastrointestinal tract. We now have the facility for pan endoscopy, which means evaluation by either a capsule camera test or indeed tubes being inserted into the intestinal tract to be able to visualize and mostly diagnose by biopsy treatment disorders that may be found within the intestinal tract. Furthermore, we have therapeutic facilities that have been brought into the endoscopy unit, such as the ERCP facility, that can combine treatment as well as diagnosis in patients, a much needed requirement for the private sector. Furthermore, the new development here in this specialized unit is the ability to diagnose functional disorders of the intestinal tract. Again, a much needed requirement for patients with long-standing reflux disease, hiatus hernias and other such disorders that cannot be simply diagnosed by endoscopy. This enables us to plan treatment as well as talk about and treatment options that with the patient, perhaps on the same day that the patient presents to the investigation unit. So all in all, it's an excellent advancement. I'm pleased to be associated with the Lanka Hospital with this advancement, and it provides the first of a kind in the private sector one-stop investigation and treatment unit for intestinal disorders.
Endoscopic ultrasonography, endobronchial ultrasound. Endoscopic ultrasound combines endoscopy and ultrasound to obtain images of the digestive tract and its surrounding structures by providing refined black and white images with contrast enhancement that helps assess the consistency of the surrounding tissue. This allows to precisely characterize the lesion and improves differential diagnosis of space-occupying lesions. Endobronchial ultrasound using linear probes is an emerging technique capable of detecting even small mediastinal lymph nodes which can be biopsied using highly sophisticated methods.
This equipment, this machine I am holding has revolutionized the management and treatment of gastrointestinal disorders. This is called endoscopic ultrasound. This is a special endoscope with a inbuilt ultrasound probe at the end of the tip of the endoscope. With this machine, we can go very near to the target organ and take very close look into what is happening inside the gastrointestinal tract. With a normal endoscope, we can see only the lining of the gastrointestinal tract. With this new machine, we can see what is underlying, what is beneath the gastrointestinal tract. For instance, we can see the cancers, we can detect early cancers, we can stage the cancers, and also we can take biopsies, we can drain cysts. Especially with this endoscopic ultrasound, which is launched first time in Sri Lanka in Lanka Hospital, has revolutionized the management and treatment of the gastrointestinal disorders in Sri Lanka.
pH, impedance and manometry studies. pH studies help to identify patients with acid-related problems, and in combination with impedance measurements, it can clearly demarcate reflux activity, in turn allowing physicians to classify gastroesophageal reflux diseases as acidic or non-acidic, and helps in management of patients with accurate medical or surgical regimes. Manometry measures the pressure and pattern of muscle contractions in the food pipe, which helps to determine abnormalities in the contractions and strength of the muscles and in the valve at the lower end of it, and treat conditions diagnosed accurately. The standalone Gastroenterology Centre of Lanka Hospitals provide a range of medical services including upper GI endoscopy, colonoscopy, bronchoscopy, organ plasma coagulation, endoscopic retrograde cholangiopancreatography (ERCP), PEG, percutaneous endoscopic gastrostomy, varicose banding, hemorrhoid therapy, all endotherapies, all biopsy procedures, enterostomal therapy, acidity studies, acid reflux studies, muscle contractibility in structures in upper GI and lower GI tract.
What is most recent and unique to the private sector in Sri Lanka is endobronchial ultrasound. Now this is different from routine bronchoscopy in the sense that the scope has an ultrasound processor attached to the tip of the bronchoscope, of a conventional type bronchoscope, and it will show us images which are from outside the trachea. Now, as in any endoscopy, we are looking inside the trachea, and the ultrasound processor enables us to look outside the wall. So this is useful in diagnosing conditions in the mediastinum.
The multi-award winning internationally accredited Lanka Hospitals PLC is poised to deliver maximum patient safety and superior care in compliance with the Joint Commission International Accreditation of the USA it is honored with.